This is Ale Mercado from BSN1B. Today I'm going to assess the thorax and lungs. In preparation for this assessment, I'm going to assemble the equipment and supplies. We are going to use the stethoscopes, skin marker or pencil, and the centimeter ruler. So today I'm going to assess the assessment of thorax and lungs. So now I'm going to explain to the client what we are going to do and what is necessary and how can he cooperate. And next I'm going to wash my hands using alcohol. And close the curtain and the window to provide privacy for my client. And next, I'm going to determine the client history of the following. Sir, do you have any family? Do you have any member of your family have illness including lung cancer?
No.
Allergies?
No.
Tuberculosis?
No.
Smoking and occupational hazard?
No.
Any medication being taken?
None.
Current problems such as swelling, coughs, wheezing, or pain?
None.
Okay, that's good. So now, sir, I'm going to assess you. I'm going first to inspect the shape and symmetry of the thorax in the posterior and lateral views. Okay, I can say that it is symmetrical and I don't see any abnormalities. So now, sir, I'm going to inspect the spinal alignment for deformities. I need you, sir, to stand up. And now, I'm going to check or observe for the three normal curvatures, cervical, thoracic, and the lumbar. Okay, I don't see any abnormalities. And next, we are going to assess the lateral deviation of spine for scoliosis. We are going to observe the standing client from the rear. Okay, sir. And I need you, sir, to bend forward at the wrist and observe from behind. Okay, I can see that the spine is aligned and I don't see any abnormalities of that. Okay, could you please sit down, sir? And for the clients who have no respiratory complaints, rapidly assess the temperature and integrity of all the chest skin. Okay, I don't feel any masses or any lesion. I can see that it's all normal. And now I'm going to palpate the posterior chest for respiratory excursion. So now, sir, I need you to take a deep breath. Inhale, exhale, inhale, exhale. Okay, I don't feel any abnormalities. Okay, next I'm going to palpate the chest for vocal, tactile, or primitus. I'm going to ask the client to say such words such as blue moon or 1, 2, 3. So now, sir, please say blue moon.
Blue moon. Blue moon. Blue moon.
Okay, that's good. And now, I'm going to percuss the thorax. There's a pattern we need to follow, starting from here, here, and from here. And next is, okay. So now, I'm going to percuss the diaphragmatic excursion. Okay, sir, inhale, exhale, inhale, and hold it, exhale. Inhale, exhale. I'm going to use my the measurement is 5 centimeter, which is the expected measure of the diaphragmatic excursion. So it's normal. So now I'm going to auscultate the chest using the flat disc diaphragm of the stethoscope. I'm going to use the systematic zigzag procedure used in percussion. So, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, on my findings, everything is normal. So now I'm going to inspect for the breathing pattern of the client. Okay, sir, I need you to take a deep breath. Inhale, exhale, inhale, exhale. Okay, I can see that the intercostal angle and the angle at which the ribs enter the spine is 90 degrees, so it is normal. So now I'm going to palpate for the anterior chest for respiratory excursion. Okay, that's good. And next, I'm going to ask the client to take a deep breath. Okay. Okay, now I'm going to palpate the primitus for in the same manner as what I did in the posterior chest. I'm going to tell the client to say 99.
99. 99. 99.
Okay, that's good. And now I'm going to percuss the chest systematically as what I did in the ano yan, palpation. Okay, that's good. And now I'm going to auscultate the trachea. Okay, that's good. And next I'm going to auscultate the anterior chest using the sequence I used in percussion. Inhale, sir. Inhale. Exhale. Inhale. 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 Okay, that's good. And after that, document the findings in the client record. Francis Alan Mercado from BSN1B. Today I'm going to assess the mouth and oropharynx. In preparation for this assessment, we need to assemble the equipment and supplies such as the examination gloves, tongue depressor, 2x2 gauze pads, and the flashlight or pen light. Okay, good day, sir. My name is Francis Alan Mercado. I'm your nurse for today. So today I'm going to assess your mouth and your oropharynx. It is essential to assess your mouth and oropharynx to know if there is any abnormalities or any disease present, and it will serve as baseline if what is the status of your mouth and oropharynx or your nasal cavity. So before that, ma'am, sir, I'm going to wash my hands and I'm going to close the curtain and the windows and the door to provide privacy for you. So it will be okay for you, sir.
Yes.
So hi again, sir. So now I'm going to ask you some questions, sir. Do you have any pattern of dental care?
Yes.
Okay. When did you last visit your dentist, sir?
6 months ago.
Okay. Do you have any present of ulcer lesion?
No.
No. Okay. Any denture discomfort? Do you wear denture, sir?
No.
No. Okay. Any medication that
None.
you were receiving today?
None.
None. Okay. That's good. And now, sir, I need you to sit comfortably, and I'll be right back. Okay. Hi, sir. So before we start the assessment, I'm going to wear my glove. We need to follow any infection control. Okay, so now, sir, let's start the assessment in your lips and buccal mucosa. So I'm going to inspect the outer symmetry and contour of the color and texture. And I'm going to ask you, sir, to purse your lips like we said. Okay, the color and the contour is normal. I don't see any abnormalities. And next, we are going to inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and any presence of lesion. So, sir, I'm going to palpate your lips. Okay. I don't feel any, the texture is smooth and it's moisture, and I don't feel any lesion or any presence of redness or abnormalities. It's all normal. And next, we are going to proceed in the teeth, assessing the teeth and gums. I'm going to assess the teeth and gums while examining the inner lips and the buccal mucosa. So now, sir, I'm going to assess your teeth. So your teeth, we are going to check if the number of teeth, if there is any cavities present, if there is any problem with that. And next, and for your gums, we are going to check if there is any present of lesion, bleeding. Okay, sir. So now, sir, I need you to open your mouth, sir. Okay. Okay, that's good, sir. You don't wear denture, sir?
No.
Okay, because in some cases, sir, some client or some person have experienced discomfort wearing their denture. And so now we are going to assess the tongue or the floor of the mouth. First, we are going to inspect for the surface of the tongue for position, color, texture of the tongue. And sir, I need you to protrude your tongue, sir. Okay, the color is normal in the texture. And next, we are going to inspect for the tongue movement. Sir, I need you to roll your tongue, sir, up. Okay, and side to side, sir. Okay, that's good. And next, we are going to inspect for the base of the tongue, the mouth floor, and the frenolium. And now, I need you, sir, to place your tongue against the roof of your mouth. Okay. So now we are going to palpate the tongue. So, sir, I need you to protrude your tongue. And I'm going to grab the tongue of the client using the piece of the skull. And now, we are going to palpate the side of the tongue and under, and the border of the tongue and its base. Okay, that's good, sir. So next, we are going to inspect for the salivary glands. First, we need to inspect the salivary duct openings for any swelling or any presence of redness. Sir, please open your mouth, sir. Okay. Okay. So now we are going to assess the palate and uvula. First, we are going to inspect for the hard and soft palate for color, shape, texture, and any presence of bony prominences. Sir, would you please open your mouth wide and tilt your head? Okay. So now, I'm going to use my tongue depressor and my pen light for proper visualization. Okay. Okay. Thank you, sir. And now, sir, I'm going to inspect your uvula for position and mobility while examining the palate. So, sir, would you please say ah? Okay. Good, sir. So now we are going to assess the oropharynx and tonsils. First, we are going to inspect for the oropharynx for color and texture. I'm going to inspect one side at a time to avoid eliciting gag reflex. To expose one side of the oropharynx, I'm going to depress the tongue depressor and the blade against the tongue on the same side about halfway back while the client tilt his head back and open the mouth wide. Okay, sir, would you please open your mouth wide? Okay. Okay, that's good, sir. And next, and I'm going to inspect the tonsil for the color, discharge, and size. So now I'm going to elicit a gag reflex by pressing the posterior tongue with the tongue depressor. So, sir, would you please open your mouth wide? Okay. And that's all for the oropharynx and tonsils assessment. And after that, document the findings in the client record.